was started a few years ago, and it was just about our whānau being sick and not being able to afford to go to the doctors.
So we know that at the moment primary care doesn't work and doesn't meet the needs for all Māori.
We've got this group of people living in these houses out at Tukunui, a few elderly amongst them as well, they're less mobile. Can we do something out there?
Try and build some connections with the hard to reach or the place that kind of lost their trust in the system.
My name is Wayne Lim. I'm the General Manager at Te Awamutu Medical Centre. The groundwork for it was started when we were approached by Pinnacle to do a pilot to establish or try out a community health worker role.
I'm Tash. I'm one of the practice nurses for Te Awamutu Medical Centre. I was approached by our practice lead a few years back about some money that was gifted to the clinic to try and help improve Māori health.
We need to do something to do more for, on an outreach basis for our patients, because we were finding very much a traditional clinic. Open our doors in the morning, people would come, we'd do stuff, they'd go away.
Well, my name is Derek Rose. I'm affiliated to Mangatoatoa Paa through marriage. I've been involved here for over 5 decades now. So my role is the joint chair with Connie Hughes. He takes care of the cultural Māori side, and I take care of the parking and business side. It would have been about June, July 2022 when we were approached by the teams from Te Medical Centre.
And it was, well, if we're going to do something, actually maybe it should be at the marae. Would the marae be interested? We thought, let's try it for 3 months. We'll take a doctor and we'll just do it. And we approached the Raukawa Trust. They were very, very generous in their support of us to try it out. A little bit of funding from them, which enabled us to provide the consults free of co-payments. Brilliant. We got to try it out in its sort of true form.
So we got the okay, we came out, we had a little tiny cabin out here at the front, and the waiting room was a little table out on the gravel and some chairs, and we'd just serve some tea and biscuits out there.
The very first day of consults, absolutely epic stories of patients who had never been to the GP before in their lives. There were a couple of patients who, had some pretty serious chronic conditions. We would say got very timely care.
No Ngāti Pare te kaua hau, ko tōku ingoa ko Hone Hughes, ko te ngā kaitiaki o te kāngani. And when we started, it was just sort of more like just for our hapu here. But then as time went on, it's gotten bigger and bigger.
Doctor and nurse, clinical pharmacist, psychologist.
Derek and Moy from their side had organised some of the infrastructure. Tainui came to the party very early on with the porta cabins, and then the Wi-Fi followed that. It wasn't far into the 3 months we'd already decided we weren't going to stop regardless, and so we just carried on. And so at that point the conversations with Justin started.
And so at the end of the 3 months trial, we put on a presentation for a Pinnacle in Waikato-Tainui. Obviously they liked what they saw.
Kia ora koutou, my name's Justin Butcher and I'm the CEO here at Pinnacle Midlands Health Network. We're a PHO that represents about 90 general practices across the Te Manawa Taki region, and that's about 470,000 patients. For Pinnacle, we have an explicit commitment to equity and biculturalism, and having a service that is being driven by the marae for the marae really resonated with us.
And it's for everybody, not just for Māori. It's for everybody, especially for our old people that can't afford to go to the doctors regularly and get their health checks and all that kind of thing, to actually come here.
I've been coming out here over the last 6 months. I'm very happy. It's been a blessing. Ko kemi tōku ingoa. I find it a lot, the formalities of going into the medical centre and not there. It's also marae-based, which is very important, for our connections. Not only that, we're not charged all the exorbitant fees that we are at the medical centre. So I'm really appreciative of that.
Haua tēnā tātou, ko Nigel iwi tōku ingoa. So I'm one of the trustees on the Mangatoatoa Paa board. And it's not just about what it's doing for our people's health, it's the whanaungatanga, all of that kind of stuff.
Kia ora, I am Rachel and I am a pharmacist prescriber at Te Whare Medical Centre. Out here I definitely see a lot of people that either wouldn't come into the clinic or won't come as often. They can't necessarily afford to or don't enjoy the environment in the clinic, and it's really nice to be a part of that.
Yeah, I mean, that's all part of Hauora. So, it's all about your spiritual side and your physical side and your mental side, all of them together.
Well, I think it's in this day and age, you can't do things alone, you've got to work in partnership. It's around respecting one another's worldview and what that looks like. Well, it's worked well for us for the last 10 years, so
I think it's keeping things simple, not making things complicated, because today we live in a world very complicated.
the partnership model really sells. We wouldn't be able to do what we do without Pinnacle.
Yeah, total.
So Pinnacle's role in the Mangatoatoa service has really just been one of enablement. We literally just have been one of the funders that have been able to walk alongside both the marae and the medical centres involved.
Well, I think the plan moving forward is, like I said, continue.
Could you do it without funding?
Judge.
For us, we've seen some amazing stories, some amazing health outcomes starting to form, but the reality is this will take time and the outcomes will take time. So for us, this isn't about 12 months or 24 months. This is about the long term.
It's not about colour, it's not about gender, it's not about demographics. It's about seeing the people and their needs and in their moment and doing the best that you can for them and taking away the barriers.
Marae-based services matter for communities like Mangatoatoa because despite best efforts, there are persistent health inequities.
I think if we did stop, then we would certainly see Whānau not engaging doctors again. The gains that have been made over the last 3 years will soon diminish.
Because when you come here, it's totally different to going into town. Because basically our people are coming home. This has actually been a great success.
Well, I've got no doubt that some of the outcome march will still alive because of the clinic.
Having it at the marae, I have a sense of belonging by coming here. Ngā mihi kia koutou kaiwhakahaere o tēnei wāhi rata. I'm honoured to be here, really.
I mean, thank you from Pinnacle for actually giving the pūtea, for actually keeping it going, because it's not an easy thing. We understand it's not an easy thing, but it's about health. It's about people's health, not about making money. And the whānau are really, really thankful that we do have this kaupapa here, the Hauora. And I think more of our pās, our marae should have it.